Imagine walking into your local pharmacy, collecting the same medications you've relied on for years, only to be told you now owe hundreds of pounds. For millions of people in their 60s, this nightmare nearly became reality. The government once considered ending free prescriptions for those aged 60 to 65, a change that would have turned essential health care into an unaffordable luxury for countless families. While that specific threat has been paused, the debate surrounding prescription costs remains more relevant than ever. Today, we're diving deep into what happened, why it matters, and what the future might hold for NHS prescription charges. The National Health Service has been a cornerstone of British life since 1948, built on the principle that healthcare should be free at the point of use. Yet one aspect of NHS care has never been completely free: prescription medications. Currently, most people in England pay a standard charge for each prescription item, but certain groups receive automatic exemptions. Among these groups are people aged 60 and over who have enjoyed free prescriptions for decades. This wasn't always a matter of settled policy. In recent years, the question of who should receive free prescriptions has sparked intense debate. With an aging population and rising healthcare costs, the government has faced difficult decisions about how to fund the NHS while ensuring fairness across generations. The consultation on changing prescription exemption ages revealed deep concerns about health equity, financial hardship, and the fundamental promise of the NHS itself. Understanding the current system is essential to grasping why proposed changes cause such alarm. In England, prescription charges apply to most adults between ages 16 and 59. Each item on a prescription currently costs around £9, and for people managing multiple chronic conditions, these costs accumulate quickly. Someone taking 5 different medications could face a bill of £45 every month, totaling over £500 annually. However, several groups receive automatic exemptions from these charges. Children under 16, young people aged 16 to 18 in full-time education, and everyone aged 60 or over pay nothing. Additionally, pregnant women, new mothers, people with certain medical conditions, and those receiving specific benefits qualify for 3 prescriptions. This system has operated for decades, with the age threshold of 60 remaining unchanged since 1974 for women and 1995 for men. The government's consultation proposed aligning the free prescription age with the state pension age, which currently stands at 66. This change would have meant that people between 60 and 65 would suddenly need to pay for their medications, potentially affecting millions of individuals. The rationale centered on fairness and sustainability. State pension age has increased over time to reflect longer life expectancy, yet the free prescription age remained frozen. Officials argued that this created an inconsistency, with some people receiving free prescriptions for 6 years before reaching pension age. Financial considerations also drove the discussion. Almost 63% of all prescription items dispensed in England are provided free because the patient is aged 60 or over. Out of 1.1 billion items dispensed annually, nearly 90% are free of charge across all exemption categories. Prescription charges generate approximately £600 million in revenue each year for the NHS, money that contributes to essential running costs for frontline services. By raising the exemption age, the government hoped to increase revenue and reduce the growing gap between those who pay and those who don't. Yet the proposal faced fierce opposition from multiple quarters. Age UK and other charities argued passionately against the change, calling it a kick in the teeth for poorly older people and the NHS itself. They emphasized that people in their 60s often face the highest medication needs of their lives, managing chronic conditions like diabetes, heart disease, arthritis, and high blood pressure. Many in this age group have retired or reduced their working hours, meaning their income has decreased precisely when their healthcare costs would surge. The financial impact on individuals would have been substantial. Someone aged 62 taking 6 regular medications would suddenly face costs exceeding £600 per year. For couples where both partners fell into this age range, the annual bill could easily exceed £1,000. These costs would hit hardest those who had recently retired on modest pensions, many of whom had planned their finances expecting free prescriptions at 60. Medical experts raised concerns about treatment adherence. Research consistently shows that when prescription costs increase, some patients ration their medications or stop taking them altogether. This leads to worse health outcomes, more emergency hospital admissions, and ultimately higher costs for the NHS. The false economy of charging for prescriptions could result in people becoming sicker, requiring more expensive interventions that far exceed any savings from prescription charges. Public response was swift and substantial. A petition calling on the government to protect free NHS prescriptions for over 60s gathered more than 46,000 signatures, triggering a parliamentary debate. Petitioners argued that over 60s are generally more susceptible to health issues and, after pension age, have less money available to pay large sums for repeated prescriptions. The groundswell of opposition made clear that this issue touched a nerve with the British public. The consultation process itself revealed the complexity of healthcare policy in a changing society. While some younger people questioned why those aged 60 to 65 should receive free prescriptions when they themselves had to pay, others recognized that prescription charges create genuine hardship across all age groups. The debate opened broader questions about whether prescription charges should exist at all, given that the rest of the NHS remains free at the point of use. Alternative proposals emerged during the discussion. Some suggested introducing means-tested exemptions so that prescription charges would be based on income rather than age alone. Others advocated for expanding the medical exemption list to cover more chronic conditions. Prescription prepayment certificates, which allow people to pay a fixed annual fee for unlimited prescriptions, offer some relief but require upfront payment that not everyone can afford. In June 2023, the government announced its decision. Taking into account cost of living pressures, the increased medical needs of an aging population, and public concern, officials confirmed that the free prescription age would remain frozen at 60. Everyone aged 60 and over would continue to receive free prescriptions on the NHS. This decision brought relief to millions, but left unresolved the underlying questions about sustainability and fairness. The reprieve, however, may be temporary. Demographic pressures continue to mount as the UK population ages. Healthcare costs rise inexorably, and the NHS faces chronic underfunding. Future governments may revisit this issue, particularly if economic conditions worsen or if the gap between pension age and prescription exemption age widens further. The consultation and debate have established the arguments on both sides, creating a framework for future policy discussions. For now, the system remains as it has been. People aged 60 and over collect their prescriptions without charge, their dates of birth printed electronically on the prescription form. Those under 60 either pay per item or purchase prepayment certificates if they have regular medication needs. The familiar pattern continues, but with the knowledge that what seems permanent in the NHS can always be questioned. The debate over NHS prescription charges for over 60s reveals fundamental tensions at the heart of modern healthcare policy. On one side stands the principle of universal access to healthcare regardless of ability to pay. On the other lies the practical reality of finite resources and the need to make difficult choices about who pays and who receives support. The decision to maintain free prescriptions for those aged 60 and over represents a victory for those who prioritize protecting vulnerable groups, but it doesn't resolve the broader challenges facing the NHS. As we look ahead, prescription charges will likely remain a contested area of health policy. The current system creates winners and losers, with some paying hundreds of pounds annually while others pay nothing for identical medications. Whether based on age, income, medical need, or some combination of factors, any system of exemptions involves drawing lines that inevitably feel arbitrary to those on the wrong side. What remains clear is that these decisions matter deeply to millions of people. Access to affordable medication isn't an abstract policy question. It's about whether someone can manage their diabetes, control their blood pressure, or ease their chronic pain. The NHS was founded on the promise that healthcare would be available to all, free at the point of need. How we define that promise in an age of rising costs and changing demographics will shape British healthcare for generations to come. For now, the prescription age stays at 60, but this chapter in the ongoing story of the NHS is far from over.